Hey guys, so you ready for it? Today's November 13th, 2025, 1:34 a.m. Central Time. This video is going to explain to you exactly what the Democrats were fighting for over this government shutdown, because no one is explaining it to the public, and the public think that subsidies for Obamacare are just disappearing. That is not the case, okay? Very quickly, yesterday, Senate passed the bill to open the government with some Democrats. House passed it with some Democrats. Signed into law by Trump, we're reopened. Did the Democrats get those subsidies extended? No. Here's the deal. It is the Democrats' fault. It is the Democrats' fault. Health insurance premiums are going to jump in 2026 for specific people on the marketplace. Obviously, health insurance premiums go up for frickin' everybody, period, for many, many reasons across the board. Whether you're in the marketplace or not, has to do with health and, how much stuff's costing us, how many people are going in and getting care now, and all kinds of crap. But that's not what I'm talking about. That's not what I'm talking about. I'm talking about specific people the Democrats allowed onto subsidies that will be pulled off those subsidies, which is why their health insurance premiums will jump because they will now have to pay it. But here's the deal. Let me explain. There's an article that I read that was really good. It's by KFF, the independent source for health policy research, polling, and news. I summarized it, okay? Here's the deal. The Affordable Care Act, ACA, financial assistance, the subsidies in ACA under Obama, has something called cost sharing reductions, or CSR. Those subsidies are permanent and part of the law. That is not what the Democrats were fighting for. Those, again, are not expiring. What's expiring are the enhanced subsidies that were temporary, that were passed under Biden. In fact, all Democrats, that's why it says not even one Republican voted for either one of these bills. This is the Democrats' fault. They passed the American Rescue Plan Act, ARPA, in 2021 that created these enhanced subsidies for 2 years, under 21 and 22. Under the Inflation Reduction Act, IRA, which was hilariously titled, in 2022, extended the enhanced subsidies until the end of this year of 2025. The enhanced subsidies, this is priceless, and this is fucking priceless, because this concept was not meant to happen under the Affordable Care Act. The Affordable Care Act was specifically for people that were in poverty, over a certain line of poverty, like 2.5 over poverty or something like that. It was basically for people who just didn't have an option for healthcare, that whether they didn't have a job or a job didn't offer it, people that couldn't afford it. That's what ACA was for. These enhanced subsidies expanded those subsidies to middle income people with incomes over 4 times the poverty level. An example is a family of 3 that makes $103,280 in 2024 would now be eligible for the enhanced subsidies. They would not be eligible for the cost sharing reductions subsidies that were under the ACA, only the enhanced subsidies. So they expanded the subsidies that were available under ACA by these enhanced subsidies to 4 times the poverty level a middle income family. Never meant to happen. Keep in mind, these enhanced subsidies are quite costly. The CBO projected that the permanent extension, which is what they wanted, but they also said, let's do it for a year and then talk about it then, would cost us taxpayers $335 billion over the next 10 years, which I think is hilariously low. And I'll show you why. I'm going to show you how many people got onto the marketplace because of these enhanced subsidies. People who were eligible for the cost sharing reductions subsidies that are permanent in the ACA also became eligible for the enhanced subsidies. So they were getting 2 subsidies towards their health insurance. The middle income people who were never eligible for subsidies and never should have been were only available to the enhanced subsidies. So here's what ended up happening. Since 2020, the number of people with the ACA marketplace coverage grew by 88% from 11.4 million to 21.4 million people. Unbelievable. Almost twice the amount of people are now in the ACA marketplace since 2020. From 2022 to 2024, here are the numbers for marketplace enrollees. Incomes up to 2.5 times poverty grew 115%. Incomes between 2.5 and 4 times poverty grew by 36%. Incomes above 4 times poverty, the new people who got the enhanced subsidies, grew by 57%, which is approximately 400,000 in 2021 to 1.5 million in 2024. If these subsidies continue, the CBO projection of $335 billion over the next 10 years is minor. Now, here's the deal. This gives you an idea of what would happen without these subsidies. Without enhanced subsidies, enrollees making just above poverty will be required to pay 2% of their income for the benchmark silver plan, period. With these enhanced subsidies, like I said, because those people are eligible for both subsidies, but with the enhanced subsidy, so they get both, they pay 0. Now, without the enhanced subsidies, for people who make just above 400% poverty level, which were not meant to be covered in the ACA, would have to pay full price for their monthly premium because they would be ineligible for any subsidy. That's how it's been since Obamacare started. With these enhanced subsidies, however, they pay no more than 8.5% of their household income. Please note, premium increases would vary by state because of the different premiums charged by insurers in each state. So these percentages, first of all, that these Democrats are coming up with, or anyone's coming up with, MSNBC, CNN, CBS, even Fox, everybody that's coming up with these percentages saying, stuff's going to rise 70%, stuff's going to rise 60, 50, 80% on these people, okay, are wrong because it totally depends on the state they're in. It totally depends on the carrier they're with. It totally depends on if they stay on the same plan. There's so many variables that it's ridiculous. The only people that these enhanced subsidies that will dramatically affect, causing their insurance, health insurance premiums to practically jump totally because they're not going to be eligible for them anymore, is the middle income people that have over 4 times the poverty level. They will not be allowed to have subsidies anymore, just like they haven't been able to have subsidies until it was passed in 2021. There's nothing new to that. This was a temporary measure. The temporary enhanced subsidies, the only reason they existed, I remember them arguing this under the American Rescue Plan Act. It had to do with COVID because so many people lost their jobs and had their pay cut, had their hours cut, all kinds of stuff, including middle income people who lost their businesses, everything. So they created these temporary enhanced subsidies to cover middle income people to get them back on their feet. It was never meant to be permanent, period. So, yes, absolutely. The price jump for health insurance premiums that the middle income class is going to see in 2026 is the Democrats' fault. They never should have passed these enhanced subsidies to begin with. They had two chances if they really wanted to, because they were bitching and whining that they wanted these permanent, that if it was up to me, it would be permanent. Several senators said while they were on the floor arguing, and I heard, if it was up to me, these would have been permanent. We wouldn't even be talking about this today. You assholes had 2 shots. You had one shot in 2021 under the American Rescue Plan Act when you created the enhanced subsidies. And then you had a second chance, because you only did it for 2 years, to pass it as a permanent thing under the Inflation Reduction Act, which again, neither one of those acts a Republican voted for. They had the entire opportunity to make these permanent if they wanted to. They had the opportunity to make this sunset in 10 years. They had the opportunity everywhere. Why did they decide to sunset this enhanced subsidy in 2025? It is extremely simple. Politics. This is why. Biden's obviously ended his reign of terror, okay, at January 20th, 2025. So whoever got in as president, it would either be yes, if it was a Democrat, we're going to extend them, and they would have extended these enhanced subsidies, or two, Trump got in, a Republican got in, we're going to use this as leverage, and we're going to get people on our side, because the middle class is going to be the ones really getting fucked over everybody else. That's why the Democrats did it. They made it end in a presidential year where either a Republican or a Democrat, whatever, would be in the White House. Democrat in the House, they extend them. Republicans in the House, leverage. That's why the Democrats chose to end the enhanced subsidies in 2025. All of this, all of these arguing, whining, bitching people, Democrats, it is your fault that premiums are jumping in 2026 for a significant amount of people that are middle income, that are just over 400, what is it? It's not percent. I keep saying percent, and it's wrong. Just over 400 times the poverty level, okay? So yeah, those people, boom, they have to pay their healthcare coverage 100% because they're not eligible for the original subsidies under Obamacare. Yes, there are people that are going to be fucked because these subsidies are going away. The subsidies were temporary. The subsidies were not meant to be permanent. These subsidies they are arguing about are not the subsidies that were passed under Obamacare. Those subsidies still exist. They're permanent. They're part of the law. It is unbelievable that these Democrats are making it out to be that millions and millions and millions of people are going to lose their healthcare coverage because of these subsidies ending. In fact, I'll tell you right now, 1.5 million, apparently, and this was, I think the article is from 2024, so it's probably even higher now. 1.5 million of the 21.4 million people in the ACA marketplace are the ones that are going to lose the one subsidy that they are eligible for, which are the enhanced subsidies. You're talking about a fraction, even though it's a lot of people, of the people that are on ACA that will be affected 100% by this enhanced subsidy going away. Because like I said, if you are eligible for the original subsidy, the cost sharing reductions, you also got a bonus. You were eligible for the enhanced subsidy too. So yeah, those people's premiums are going to be going up too, but they're not going to be losing those cost sharing reductions. So the Democrats really, I guarantee they thought this concept through. It should have been a temporary thing they passed for 2 years, called it a day. They extended it to 2025 because it was a presidential year. They weren't worried about it if a Democrat got in, and they were going to use it as leverage if a Republican got in. And that's exactly what happened. Now you're going to be hearing forever, even though the Senate said they're going to vote on this stuff, and they may very well extend the enhanced subsidies because it could lose some of their seats. Republicans could lose some of their seats and stuff like that, depending on the state they're in. Because again, your premiums are different in different states, which is exactly why Congress should pass that health insurance carriers can cross state lines. That's what they can't do right now. So here in Missouri, if a health insurance carrier is providing me insurance, they can't provide the same insurance or any type of insurance, period, to someone in Illinois because they can't cross state lines, which causes a monopoly within all the states. When you start a larger pool of people coming at you for a product, negotiations happen, prices start to fall. Insurance carriers need to be able to cross state lines, and a lot of things would change for everyone in the United States, not just people in the marketplace. It would be everyone, period, who has insurance through their employers or otherwise. But they aren't doing that. They haven't been doing that. I don't understand why. It would help the marketplace. It would help everyone with health insurance. Why they're not doing that, I don't know. Regardless, Democrats' fault. Health insurance premiums in 2026 are going to jump, especially for the middle class, 400 over poverty, okay? Those people are going to be the ones getting screwed because they're going to be having to pay for their health care coverage or premiums 100%. That's it. Again, it was a temporary measure. They never should have passed it for an additional 3 years. This is Are You Ready For It? Take care, guys. Have a great day.